Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat. I'm really pleased today to have Dr. Martin Whitehead with us, researcher, veterinary surgeon, also from Liverpool, an alumni of Liverpool University where I studied as well. So great to have you on the podcast, Martin.
Hello.
And we're going to be talking today about hyperthyroidism, which I know is one of your many passions. But perhaps before we do start, tell us a little bit about that very varied history that you have on your slightly circuitous path to becoming a vet. You've done some really interesting stuff before you actually trained to be a vet, didn't you?
Yes, I did a psychology degree, and then I did a PhD studying basically how ears work. And at that time, it wasn't really known at all how they work. They can detect sounds so small it just seemed impossible. And it was worked out that there's actually a mechanical amplifier inside your inner ear that vibrates in response to the sound that comes in and builds up the vibrations in the ear, and little sounds leak out of the ear as a result of that. And they're called otoacoustic emissions. I did my PhD trying to work out how they were produced and how they relate to hearing, and that went on to be to lead to the development of clinical tests. So newborn babies are tested with that to see if they can hear these days. And as I was working away on that in the USA, I worked in Houston and Baltimore and Miami studying this stuff. Over time, people who were interested in wild animals would call me up and say, "Can you use this test to see if they've got hearing problems?" So I went off to San Diego and we caught elephant seals and other seals on the beach and tested them, and I tested manatees and other things. And at the same time, I was sort of losing interest in the science way of life. You end up spending your life getting grants rather than actually doing the science. So I retrained as a vet, thinking I might do wildlife stuff. But then I got really interested in the internal medicine. So that's what I do now.
That's fantastic, Martin. And obviously, we've all heard of the BAER test, which I know at Liverpool, Jeff Skerritt was a big fan of that. This is obviously, a further development on the test as well, isn't it? A more recent test, your O2 acoustic emission test, which, as you say, it must be very satisfying to see a test that is now used internationally and that you were involved in developing.
Oh yeah, it's great to look back and see that you've done something useful among a team of lots of other
No,
people,
it's really
obviously
good.
involved.
Yes. Yeah. No, absolutely. And I know today we wanted to talk about hyperthyroidism. I know it's a big interest of yours, and obviously as a great cat lover, it's been a big interest for me as well. And I remember researching it when I was doing my dermatology certificate, and because I had a case a cat that was just sort of licking and scratching, and actually by treating its thyroid medically, we stopped the scratching. And this had been a cat that had been on steroids and everything, and it was quite a complex case, but we got it better. Uh, and really at that stage, hypothyroidism was building up in its incidence, because this is a disease that if my memory of the literature is right, was really only diagnosed in the 70s, wasn't it?
Yeah, Mark Peterson in
As a
America,
definitive diagnosis.
he was the one who
Yeah.
recognised it about 78, I think. And it does
Yeah,
seem
I think
to
it was 78.
not been around before that. And now it's just incredibly common in the Western world.
And it's really interesting. Obviously, both of us keen environmentalists. I remember reading a report about, coating of cans. But I know you also think there's other pollutants that are involved, and actually you've seen some of the research on that. So perhaps tell us a little bit about why you think hypothyroidism has come from kind of not very common at all to becoming such a common endocrinological disease in cats.
Well, yeah, the truth is we don't know why it's become so common, but there are suggestions. There's probably a genetic component because certain breeds seem to be a bit protected, Siamese and
Yeah.
Tonkinese, Burmese. So that does suggest maybe a genetic component. But there's a lot of circumstantial evidence, correlations really, between levels of certain chemicals in the blood of cats. Uh, Hyperthyroid cats have high levels of these chemicals in their blood compared to age match control cats. And then there's risk
Yeah.
factor evidence from epidemiological studies where hyperthyroid cats compared to control cats are found to, say, eat more fish flavored food or to eat more tin food.
Mm.
And that might indicate that they're being exposed to certain chemicals that have a structure, a chemical structure that you could imagine could be playing about with your thyroid glands. So
Mm.
we don't know, but it's quite plausible and suggestive, the evidence that's out there, that there may be endocrine disrupting chemicals causing hypothyroidism in the same way as endocrine disrupting chemicals are causing things in humans as well, and other species.
Because of course there is so much chemicals, drugs that are excreted by us if we take tablets and so on, that can go into the waterways and obviously can go into oceans. And we also know clearly the amount of plastic that the stat I had recently was by 2050 there'll be more plastic in the ocean than fish, which is, just a terrible thing to imagine, isn't it?
Yeah, I mean, but it's not just drugs coming out of people. It's
Yeah.
industrial chemicals,
Yeah.
pesticides, and one of the key chemical groups that are thought may be involved in increasing the risk of hypothyroidism in cats is flame retardants put into furniture. Obviously, flame retardants are a
Mm.
really good idea for obvious reasons,
Yes.
but possibly they are involved in the etiology of hypothyroidism too.
It's like anything. It's risk analysis, isn't it? How many people's lives have been saved by flame retardants in sofas compared with potential risks of them or cats getting thyroid disease and so on. Moving on from the etiology, obviously we've made our diagnosis, which is usually relatively routine, although there are some challenges. Do you want to talk about anything around diagnosis that you think that sometimes we can make a mistake on diagnosing hypothyroidism, or perhaps not diagnosing it?
Yeah, I mean, there's a whole range of issues. Most cases are very simple, really, but
Yeah.
um, quite a lot of older cats that are hypothyroid and have a thyroid hormone in the top half of the normal range. And it's something I notice in cats that are referred to me. Some of the cats who come, I look back through the history, and for several previous blood samples, they've had thyroid hormones, maybe 40 or 50, where the top of the normal range is 50 to 60. And
Yeah.
they've eventually, the thyroid hormones come above that range, but I would imagine those cats have been hypothyroid, but not recognized for quite some time. Uh,
Yeah.
Obviously, there's the well known problem that other diseases can suppress your thyroid hormone. So um, that's one way of missing hypothyroidism.
Yeah.
Um, so yeah, there's and the other, I guess, awkwardness is while most cats are pretty classic, they lose weight, they eat more, and the rest of it. Some cats they have this what they call atypical hypothyroidism, and they're more like a sort of
Mm.
generally ill cat. They might be off their food. But occasionally we see cats who are hypothyroid that way, so they're not eating a lot. They're quite different. So they can
I
be
think
different.
it's more and more. Yeah, it's more and more recognized now because, of course, a lot of the geriatric profiles that we might do for a cat, we're looking at kidneys, we're looking at liver, but we're definitely also, most of the time, there's a T4 in there as well, isn't there?
Yeah, absolutely. And quite a lot of the cats who come to me haven't had, well, maybe the owner hadn't noticed anything, but they have a pre-op check for a dental or just an old age check or
Yeah,
whatever. And then when the vet says, well, the thyroid hormone level's up, have you seen anything? Have they been eating more? And the owners go, oh, yeah, yeah, I thought so. And it's sort of one of the problems with
yeah,
hypothyroidism. It's such an insidious, slow onset and the cats tend to be
Yes.
maybe a little more active and they eat more, so they actually look to owners like really healthy cats.
Yes.
So,
And maybe lose a bit of weight, and if they've been
yeah,
overweight anyway, that's been a good thing for them.
yeah.
What's your sort of favorite treatment options then, or how do you decide which treatment you're going to use, sort of medical, surgical, or perhaps sort of a radioactive isotope medical treatment?
Well, you've actually got four treatment choices, and they all have their places. There's
Yeah,
medicine, but also the very low iodine diet, and
yeah,
they're management options for the disease. They don't cure it. The thyroid is still
yeah,
there, growing away, as it were, slowly over time. And then you've got two curative options, which are surgery and the radioiodine therapy. Now, obviously, I run a radioiodine unit, so I tend to be pretty keen on that. But it is, I think, generally regarded by the experts that the radioiodine therapy, under most circumstances, is the gold standard treatment. Partly, obviously, because
yeah,
it's curative, partly because it
yeah,
doesn't involve a general anaesthetic, as surgeries do, and
yeah,
partly because it has an extremely high success rate, and a
yeah,
pretty low side effect rate. Really, the only real side effect it can have is to make some cats hypothyroid. Um, there's also this
yeah,
business where if a cat has pre-existing renal disease, and then you cure the hyperthyroidism, you reduce the
yeah,
glomerular filtration rate, and you can expose that pre-existing renal disease. That's not so much a side effect, it's as such, because you're just exposing a disease that was already there.
hmm.
So
But the high basal metabolic rate that the hypothyroidism was bringing was protective to the kidneys, wasn't it?
exactly, yeah. The glomerular filtration rate is high,
Yeah,
so more fluids going through the kidneys, so it gets rid of the urea and creatinine more effectively.
yeah,
But there are times when radioiodine treatment maybe is not such a good idea. Apart from anything else, it's quite an expensive one-off cost.
yeah,
It's over years. It's probably cheaper than buying the drugs month on month and doing
yeah,
repeat blood tests that you often need when you're using drug treatment. But if, say,
yes,
you've got a 17-year-old cat, you might be better off, or it might be cheaper if a cat's not insured to treat it with drugs than it is to use
yeah,
radioiodine therapy. Or if you say you had a cat with some sort of cancer and it becomes hypothyroid, well, if the cancer is going to be life limiting, maybe you don't want to be spending £2,500 treating with radioiodine if in 4 months' time the cancer is likely to have killed the cat.
hmm.
So
Just interestingly, with the thyroid gland, um, what are the sort of percentages of uh, tumorous thyroid glands compared with, a simple hyperplasia? And do we know how that kind of hyperplasia develops?
um, uh, the the percent of cancer, thyroid carcinomas, is very low. The figures often banded about something like 1 to 2%, but obviously a lot of those studies tend to come out of the places that get hypothyroid cats referred to them. So
Yeah,
I think the incidence in the general practice population is a bit lower than that. Certainly, the cats I
yeah,
see, and again, I get a lot of the ones that don't respond well to medical treatments, and a lot of
yeah.
those just have, as it were, standard but severe hypothyroidism. But the carcinomas can be included in them, and I'm probably seeing about 1% of cases that have a cancer.
Hmm. How are you recognizing those? Is that palpation they're bigger? Do you do cytology on those? What's the kind of how
Well,
do
the
you
honest
spot those
answer is
tumors?
sometimes we don't recognise them. But
Yeah,
if the the risk factors for having a carcinoma are bigger goiters, for sure,
yeah,
but most cats with a big goiter don't have a carcinoma. Having a very
yeah,
high thyroid hormone level, for sure, but still, those with a
Yeah.
very high thyroid hormone, most of them don't have a carcinoma. Um,
Yeah.
Having a very high thyroid hormone level, but not having a palpable goiter, because sometimes they sort of sink down into the thoracic inlet where you can't feel them. Um,
Yeah.
Having been hyperthyroid for a long time, years, even if you've been on medication or if the cat's been on medication, because you can get a sort of the standard sort of adenomas and hyperplasias can undergo a sort of uh, a transformation into a proper cancer. Um,
Hmm.
and another risk factor I would say is cats who've been stably treated with medication for a long time, and then they sort of lose control, and you're upping the dose of the thyroid medicine to very high levels and still not controlling it. So those are suggestive, but really to sort of nail it, I'm afraid cytology has been shown to be pretty much useless to tell cancerous and
Right.
non-cancerous apart.
Yeah.
Histopath can do it,
Histopath.
um,
Yeah.
but then obviously you'd probably be removing at least most of the goiter you can feel anyway, because why would you do an incisional one? You do an excisional.
Yeah.
And other than that, you can do maybe an MRI or a contrast CT, because you're looking for METs throughout
Yeah.
the cat, and also scintigraphy, where you inject pertechnate. There's not many places in the UK that do that. A couple of the vet schools do for sure. So there are ways to try
Yeah.
and tell. But another, um, I guess you call it very, very strong indicator, but you don't see it very often, is if the goiter doesn't move in the neck. So normally you feel the goiter and it sort of flips and it moves under your thumb.
Yeah.
If it doesn't do that, it's probably an invasive thing. So that is very likely to be a carcinoma.
So is that where, if you're suspicious of that, you may do surgery? And is there an argument post doing that, if you think there may be Mets elsewhere that could be hormonally active, that you would still give radioactive iodine, or would that not be effective against the Mets?
Well, the standard treatment we do for your typical hypothyroid cat, um, we give about anywhere from 70 to maybe up to 180 megabecquerels of the units of iodine we give.
Yes.
You certainly can treat carcinomas, thyroid carcinomas with radiation, but it's more like a dose of 1100 megabecquerels. And whereas the treatment for standard hypothyroidism has an extremely high success rate, up in the high 90s%, the treatment for
Yes.
thyroid carcinomas is a lot less certain. It certainly does work, and it has cured some cats, but
Yeah.
it's not something it's. If people bring me a cat, I can almost guarantee them that I'll get it better if it's got the standard hypothyroidism, but I certainly wouldn't say that
Yeah.
if it's got a carcinoma.
A carcinoma. No, that's really interesting. And and obviously I remember Ian Ramsey's a great friend of the webinar vet. I went to university with him. He, I think, set up one of the first of the radioactive iodine centres. How many are there in the country now, Martin? Is
Uh,
this becoming a more and more common treatment?
15 that I know of.
15.
Yeah, so several in vet schools, a
Yes.
few in the big referral places. So Willows in Solihull has got one, Pride Referrals,
Hmm.
Chester Gate, Jeff Skerritt again. I don't know if he's
Yes.
still there, but he set it up.
Yeah.
Anderson Laws has got one. And there's a few places like myself where we're, I suppose, we're not big referral places, but I suppose higher grade first opinion places. So yeah,
Yeah. But
15 that
you,
I know of.
yeah, they're satisfying cases if you can give one injection. It saves and it sorts the problem out. Otherwise, this is a problem of compliance because clients will have difficulty in pilling cats, won't they?
Oh, absolutely, yeah, and it's one of the big pluses of radioiodine therapy, and obviously surgery too. Is they don't have that problem of every day, once or twice a day,
Yeah.
having to treat the cat, and even if they're going off on holiday, and yeah, so it is a great thing. And many cats obviously hate having tablets and drops and stuff shoved down them.
Yeah. And obviously, it is radioactive.
Yeah.
What are the sort of safety precautions that you're taking, and then how long is the cat with you before the client can pick the cat up again?
Yeah, the the radioactivity is the bulk of the work. To be honest, the treatment is in itself really a doddle. You have to work out the right dose of
Yeah,
radiation to give the cat and make sure it's suitable for the treatment. That's for a vet a very easy thing to do. But to set up a unit is quite an undertaking in itself. Going through, you have to get a permit from
yeah,
the Environment Agency, and that is a scary amount of work. Um, you have to have a suitable site. The cats and the vials, the radiation come in, have to be shielded from the public and your staff. And the easiest way
mm,
to do that is just with distance. So you can't really set up a radioiodine unit in a room in your hospital, for instance. Or if you did, you'd have to have a very large amount of lead, which is
yeah.
expensive and
Expensive.
heavy to put on a wall. You need a very, very solid wall to do that. If there's someone upstairs, you need to shield your ceiling. If there's someone downstairs, you need to shield your
Yeah,
floor. So the best thing is to have a sort of building outside, or at least on the back
yeah,
of your hospital. And many practices just don't have. We were lucky; we had some extra land on our site where we could put such a building. And then when you're working, it's about contamination. So we wear
yeah,
aprons, we double gloves. Actually, we use rectal gloves, visors, and masks, and overshoes. And the levels of radiation are not that huge. Obviously, it's safe for the cat to be injected with it,
yeah,
so it's not that sort of immediate damage. What you're protecting yourself against is an increased risk of cancer from exposure to radiation over your life.
yeah,
We all get background radiation at a very low level. We all occasionally have X rays or CTs. Some people work in industries where there's a bit of radiation. If you get on a jet plane and fly abroad, you're getting an increased exposure to radiation. And you just want to, the more of that you have, the more likely you are to get cancer when you get old. So really, the
yeah.
safety,
Cumulative.
that's what you're trying to avoid. It's you're protecting, stopping yourself getting contaminated now to reduce your risk of cancer in 30 years' time is what it's about.
Hmm.
But
And
it's a,
how many cases are you treating a year, Martin?
at the moment we're doing about 160 a year, and that's increasing year on year. And we've got the capacity to do
Yeah.
probably 400 a year if it builds up to that, which maybe it will one day. Um,
So you have perhaps space for two cats at any one time. I
no,
know they're in
we
for a
can have
few
12
days,
cats
so they
at any
may be
one
in and
time.
out.
Yeah,
12.
12 at any one time.
And they're all at different stages because some of them will come in the next day, they'll get their injection. And then are they usually in for about 5 to 7 days?
It, 3 to 10 days. So we have one or two
Yeah.
cats have gone home after 2 days if they're given a very low end dose. But yeah,
Yeah.
and our maximum time in the radioiodine unit, unless say it was a carcinoma, they'd be in a bit longer. Our maximum standard time is 10 days.
No, it's fascinating. It's what was the history of finding this? This was presumably used in humans first, was it, and then translated across to cats?
Yeah, it's been used in humans since the 1930s, I think. Might even have been 1920s.
Right.
And yeah,
Okay.
we just vets just modified it. So I think again it was Mark Peterson who was the first person to do it in America.
Yeah.
But it's been used since I think early 80s in cats. Cats in some ways are actually a bit better designed for it than people. People have only one thyroid gland. Cats obviously have two, sometimes a bit of ectopic
Yeah.
tissue. So I think cats are less likely probably to become hypothyroid after the treatment.
Yeah.
But still, plenty of them do it.
And do you ever have some cases where you've had to go back and give a second injection somewhere down the line?
Only one, in fact, out of well
Right.
over
So it's
500 cats we've treated. And that one almost got
yeah.
better. It just the T4 didn't quite get down into the reference range.
Yeah.
So I mean, that shows you the success rate. Yeah.
It's fascinating, Martin. That is a pretty good success rate. If you had that for all of your medical cases, you'd be quite happy, and I
Oh
think very
yes. Yeah.
popular with with pet owners, wouldn't you?
Yeah. And we do say to people when they come, if we don't fix your cat with the first injection, the second one's free. As I say, we've only done 1 second injection so far.
Right. It's a good guarantee.
Yeah.
Martin, it's been great speaking to you. I think it's really good that we have these treatments for our feline friends for what has become a very common condition. Obviously, we need to look at why that's happening and perhaps learn more about the etiology and see if there are ways that we can prevent it. But I think once the disease is there, then this seems like an excellent treatment compared with operating, which was always a bit of a scary surgery, wasn't it? You were worried about hitting the parathyroid glands and things like that as well and causing issues. So it seems very low risk compared with the surgery.
It is low risk. It's a little bit more expensive. I mean, a unilateral
Mm,
thyroidectomy is a fairly quick, easy thing, really. But most cats who have a unilateral thyroidectomy become hyperthyroid within a year or two
yeah.
with the other glands. So, but the bilateral one is, it does have quite a high complication rate, especially with the low
Mm.
calcium because of the parathyroids. Yeah,
And the nice thing is, of course, the iodine is very specific to the thyroid, so it doesn't attack the parathyroid gland.
exactly. Beautifully
Yeah,
specific.
yeah,
Yeah.
yeah, fantastic. Martin, it's been a thrill to have you on. Thank you for all the great work you're doing in this and in your other sustainability and environmental areas.
All right. Thank you very much.